ready to dig a little deeper. Today, we're taking a look at something that you don't always hear about together: autism and inflammatory bowel disease, or IBD for short. We're really diving into this connection today, and I have to say, the stuff you sent over is fascinating.
Yeah, it's really interesting how these two things, they seem totally different on the surface, but when you look closer, there's actually a lot of overlap.
Exactly, and our main source today is this article from Cheap ABA, Understanding the Connection Between Autism and Inflammatory Bowel Disease. And, even just reading the title, you kind of get a sense that this is important stuff, especially for families, right?
Well, for sure, for families dealing with both, this is huge. This isn't just some abstract medical thing. This is their everyday life.
Absolutely. And I think before we even get into the why here, it's important to be clear that IBD, this isn't just like having a bit of a stomach ache, right? We're talking about serious conditions like what, Crohn's disease, ulcerative colitis. These are the big ones, right?
Exactly. Yeah. And the article goes into some of the symptoms. And I mean, we're talking like persistent diarrhea, really bad abdominal pain. Some people even experience weight loss. It can be really debilitating.
Wow. Yeah. So this is something that can have a huge impact on someone's, their day-to-day life, how they function.
Yeah.
And then you think about someone on the autism spectrum who might already be dealing with, I don't know, sensory sensitivities, communication challenges, maybe social anxiety. Could these digestive issues actually make those existing challenges even worse?
That's such a good question. And honestly, when you look at the research, it seems like the answer is unfortunately yes. Like imagine a child with autism who's having a hard time communicating that they're in pain or they're experiencing sensory overload because of digestive issues. It just creates this whole other layer of difficulty.
It's like a vicious cycle almost, right?
Mm.
And one of the things that really struck me in the article was this statistic. It said that almost 70% of children with autism experience gastrointestinal problems,
Mm.
including IBD. 70%. That just seems incredibly high.
It is. It's a huge difference compared to the general population, which is somewhere between like 0.5 and 1%, So the fact that it's so much higher in people with autism, that really makes you stop and think, what's the connection?
It really does. It's
Yeah.
like, okay, there's got to be something else going on here, something deeper.
Exactly. And there are a lot of researchers trying to figure that out, looking at things like, have you heard of the gut-brain axis?
The gut-brain axis. I feel like that's got to be a whole other deep dive. But yeah, I've heard the term. I'm not sure I totally get it. It sounds very like sci-fi.
Yeah, a little bit, but it's actually pretty fascinating. Basically, it means there's this constant communication going on between your gut and your brain, like a highway of information back and forth. And what's really interesting is that they're finding similar imbalances in the gut microbiome. That's the community of bacteria living in our gut, in both individuals with autism, AIND, those with IBD.
Oh, wow. Okay, so it's like there's this shared factor, this
Yeah.
common thing that might be playing a role in both conditions.
That's
It's super interesting. So it's more than just like, oh, you are what you eat kind of thing. This is really about how these bacteria or the lack of certain bacteria can actually impact both our physical and mental health. Wild.
It really is. And, going back to that impact on daily life, the article talks about how for someone with autism, dealing with IBD symptoms on top of everything else can make things so much harder. It's like, imagine trying to navigate a world that's already kind of overwhelming from a sensory perspective. And then you add, I don't know, imagine like a teenager in a really loud, busy classroom, and suddenly they're hit with this intense stomach pain.
Oh, man. Yeah.
It's a recipe for sensory overload, anxiety, you name it.
Yeah, it just makes you realize how crucial it is to find the right support.
Yeah.
And the article actually talks a lot about that, about the importance of personalized care when it comes to managing IBD in the context of autism.
100%. And it starts with finding healthcare providers who get it, who understand both autism and IBD, because you can't just treat these things in isolation, right? You need someone who sees the whole picture.
Totally. And this whole idea of personalized care seems especially important when you're talking about diet, which the article gets into as well. And I know that can be a really sensitive subject, especially for families dealing with autism and picky eating, which is like so common.
Oh, absolutely. But what I liked about how the article approached it was it's not about forcing anyone to eat things they hate.
Yeah.
It's about working with someone like a registered dietitian who understands both conditions, who can help you figure out a meal plan that works for that individual.
Yeah, like finding that sweet spot, good for the gut, but also something the person will actually eat.
Exactly. Because at the end of the day, it's about what actually helps that person thrive, right?
Totally. And it seems like routine probably plays a big role in that too, when you say.
Yeah.
I know the article mentioned how routines can be really calming for people with autism. And I'm wondering if that applies here as well.
Absolutely. I think any kind of predictability, whether it's meal times, medication schedules, even just a consistent sleep-wake cycle, all of that can contribute to a sense of stability, which can be really grounding for anyone, but especially for someone with autism.
It's like if your body knows what to expect, it can relax a little, right?
Exactly. And when you reduce that stress, that can have a positive impact on both the gut and the brain. It's all connected.
It really is amazing how connected everything is. And, it makes you think about not just the physical stuff, but the emotional side of things too.
It's true, and I imagine that emotional burden can be really heavy, especially for families who are already, maybe dealing with the stress of getting a diagnosis, figuring out treatment plans. It can be a lot. Oh, absolutely. It's a huge amount to handle.
Yeah.
And that's actually something the article talks about too. Like, it's not just about the physical symptoms, it's about the emotional and psychological well-being of the individual and their family. Finding the right support is so important, whether it's a support group, a therapist who specializes in these areas. These resources can make a world of difference for families who are feeling, overwhelmed or alone.
Yeah, finding that community, knowing you're not alone in this, that's huge.
Yeah.
It's so easy to get caught up in the day-to-day management of symptoms that you kind of forget to take care of yourself. It's
Mhm.
like emotionally, mentally. This has been a really, really interesting deep dive, I have to say. We've covered so much ground, from like gut bacteria to the importance of finding the right healthcare provider. It's a lot to think about.
It really is. And honestly, it just shows how much we still don't know about all of this. But
Yeah.
but even without all the answers, I think the big takeaway is that personalized care is key, right?
Mm.
There's no one size fits all approach. It's about figuring out what works for that individual person.
Totally. And that starts with being informed, right?
Mhm.
Like doing these kinds of deep dives, educating ourselves so we can be the best advocates we can be for ourselves or our loved ones. Knowledge is power, as they say.
It really is. So keep asking questions, keep learning, keep reaching out to those resources. It all makes a difference.
Couldn't agree more. You're not alone in this, and there's so much support out there. So keep learning, keep advocating, and we'll keep having these conversations. That's it for today's deep dive. We'll see you next time.